two incisors. Tips, that is labial and lingual. The choice of diamond which you use will be TR11. Okay, I'm being very specific with the diamond. Why? Because if you use a round, you will create a shallow opening, and when you do that, you will make the enamel so thin that if you flick it, it will break. So you will need some amount of denting to be present there. So that's why TR11 is one of the most tiniest diamonds which you have. Two, you really need magnification. Really need magnification. Okay, without magnification, it's close to impossible for you to do this. So you will then remove. As far as the labial portion is considered, always look for craze lines. Always. Craze lines are the most difficult ones to treat. Now, will I retain or remove a craze line? That depends upon where the craze line starts and where the craze line stops. Now, what line you're seeing on top is only one dimension. You have no clue till what depth it is actually going down. Absolutely no. If you start removing it, it can go up to DEJ, cross DEJ, it can go even into dentin. Now, if you're going to keep cutting the tooth structure just because there is a craze, you will land up with more problems than actually solving the existing problem. So, we divide this into two parts. One is to treat the incisal decay first, then you start diastem. So we go ahead. You create all those lines, effects. Can you tell me what this is? What could be the reason? You have read, no? V-shaped notch. I told you, 50-year-old man. That fellow should have dinosaur nails to have. No, that's a CEO. That has 2,000 crores in his pocket. Definitely not a trader. Yeah, very rich guy. Rich guy, but see the teeth. Yeah? What will she say? Correct? No. Crossed. You see, in clinical practice, you should understand two things. The poorest of poorest people will have the bad oral hygiene, and the richest of the richest people will also have a damn bad oral hygiene. I'm telling you, you know why? Very few people reach them that close. And unfortunately, we are one among them who will be the closest to his mouth than anybody else. And you will see that you will sometimes think that, damn man, this guy doesn't know how to brush or he brushes. You can't ask questions also. Imagine that this is a very rich guy and you ask him, do you brush? And then, so obviously doc, and you will know that that fellow has not touched the brush, or I will have no. There are so many instances when this fellow walked in, he had visited around 5 to 6 clinics. He owns a software company, and everybody had told crowns. I was the only person who said, I'm not going to do crowns. And his reason of sitting in the dental chair is because I said no crowns. Cost was not the criteria. In fact, my charge was more, 2 times more than what the crowns were. But still, he was okay. But the point is, your treatment plan is what you own. So, think, tomorrow I'll tell you what it is. Think of all permutations and combinations. Now, we want to do this. So how do we start? Same way. You see the prep? You see the labial portion? You see the lingual portion? You see one slot which is prepared? That is all is the prep. Okay, so I start building the height first. Okay, then you see the bevel. Then we need to mask the teeth. So when we need to mask, what we do? We put A2O. I'm not deviating the technique because one single technique, if I teach you thoroughly, it becomes easy for you to follow. If I bring in a new technique here, then whatever two classes which you had, you will again get confused. So incisive buildup followed by application of A2O so that you're masking all the discolorations, everything. Now if you see there, you still can see the crack line, craze line over there. I have left it. I am not going to dig inside that craze line. Why? Because I am going to cover it completely with composites. Next, you do the proximal shelf. Okay. Now, this proximal shelf was created using a proximal band. So you place the proximal band, then you create this shelf. Then you connect that to the palatal shelf which already you have created. Then the whole thing becomes simple. You add, you build it. Okay? Once this is done, repeat the same exercise on the other tooth, and the other tooth, other tooth, other tooth. And how long will it take? It takes quite a long time. Very long time, so much so that you will know everything about the patient. Then you build it. Now, is this build up right? No. One is square, one is triangular. Can you correct it? Of course, you can correct it. Why? Because you already have an index, you already have finished the adjacent tooth. Now, the second part of the truth is patients don't know the shape of a given tooth structure, especially guys. Okay? All they will need is to protect the tooth, close the gap. So sometimes there will be a little mismatch between one central to the other central. It is okay to have that mismatch. Don't make it look too perfect. If you make it look too perfect, then you remember nobody wants anybody to know that we have done something on their teeth. And if somebody looks at you more than 10 seconds at your teeth, you will always curse the dentist. How many times I've told him nobody should know, but then, so you correct and you finish. This is before finishing and polishing. Now, if you see this, if you build it like this, easier to do your mock-ups. Okay, that is when you will calculate this emergence profile. Anything more than 0.75 mm, if you increase your emergence profile, there is always a good chance that the foot will get stuck over there. Now, will this emergence profile remain constant? No. This emergence profile will go off depending upon the brushing of a given patient when you are doing it with composites. When you are doing it with ceramic, it remains constant. Okay. Now, if this emergence profile goes off, okay, will the patient complain? No. Patient will have got used to it by the time. Now, how different it is between what I am trying to tell you is, now watch the canine. You see the proximal surface of the canine? Can you see how it is being raised, but there is no elevation? But if you see the central, you're able to see that rectangular build up, right? So, if this kind of an emergence profile is going to come in your mock-up, you will have to prep your tooth. You get it? Now, when will you decide to prep and when will you decide not not to prep. That you have to take a call depending upon one, what the patient wants, two, how much of aesthetics is in importance, three, the external face, height of the lip, thickness of the lip, and whether they have a lip line which shows maximum teeth or not. All this only will take into consideration whether you will require this kind of a treatment or not. If you don't require it, then it really, really doesn't matter this emergence profile. Got it? Clear? Any doubts you have with diastemas? We'll stick with one technique because I want you to do this technique. Only when you do this technique, then you will understand. Okay. What do you see? Fast. Okay. Treatment options. What do you want? Let's go with PGs first this time. You want to do direct composites? Direct or indirect? You want to do indirect. Okay, fair enough. Cost is not a criteria. Anybody for direct? So what's the plan? You'll prep, then okay, she wants to prep, she wants to take measurements, send it to the lab, finish off, indirect. Now, the most important people here, interns. You know why? Because you are unadulterated, altered. Wrong word to use. Because as postgraduates, they cannot think. For some reason, they take the thinking cap. First year they will have. 6 months from first year, no? They forget to think, and sometimes I feel that poor souls. There's a meme, okay? There's a meme. That meme made me laugh like anything. I really wanted to show that meme to you guys. There is one saint called Nityananda. I don't know how many of you will figure it out. Okay, that dude, what he talks, no? If you listen to it, the worst problem in your life will get solved. Okay, so he comes one day morning. I get up, my friend is a very strong devotee of. He says, next to God he is, because when I see him, no, when this idiot is able to live like this, anybody can live in this life. Okay, so he says, next 3 years you be alive. Somehow you be alive. I want to put this caption for all the PGs. Okay. After that you come out, I will take care of you. PG's life is like that. Somehow, somewhere they forget to enjoy for what they have actually joined the course. Internship is like that. Nobody can control. None whatsoever. You can actually walk over a PG and say nonsense to you, and then you can walk off. They can't do anything. Nothing. Absolutely nothing. You are not under mercy of anything, not even your own thing. So when you think, no, you think loud. What's your treatment? Direct. Now, the funniest part of all this is, you remember first time when I showed you and I spoke to you, I can make you think the way I want you to think. This is actually post-op. Okay? Post-op. This is pre-op. That's what I'm trying to tell you. Okay? If I can fool you guys, in thinking of doing a treatment for a teeth which is already being treated. The rest is very, very easy for me to do. This is how the patient came. This is how the teeth were etched, bonded. What you're seeing is bonding. Why this? Because this is what we're going to do today. Root canal treated. I did the root canal. Then you light cure. After that, you apply a thin resin coat. Good question. Is it on the labial surface or on the lingual surface? I will remove it. But right now I left it because I wanted that enamel intact.
But then you have bonded as well.
Correct. Only on the labial surface. Now if I take that off, I will need an index point. You understand? That is 0.5 mm. You see the rim of enamel on top? If I take it, it will become a hole. Then I have to do an index. Then I have to build it up. I will leave this, fill up the labial surface, then go back, remove the caries from behind. So I already have a labial index done. Now, how many coats of bonding did I apply? Why? Why 2 coats? Yeah? What's the reason? Bonding is right. Let's leave off bonding, okay? Just remember when you use shofu, please apply 2 coats. PGs are nightmare with bonding. Now, after bonding, you apply, that is your injectables, thin layer, and resin coating it. See, the entire periphery is in enamel. Watch when it light cures. Where is the glow happening? No, you see one glow. No? It's only in the center, right? Why is not the other structures glowing? It's actually the reverse. Dentin glows when you light cure. Enamel allows light to pass through. So now, that's the only good dentin which I have. The rest is all gone case. Central, no? That's also RC treated. Both are RC treated. Prep. Build up. Layer by layer. And then you finish. So, when you finish, like I said, nobody should appreciate your work. If somebody appreciates your work, it means it is lousy. And when you show and then somebody starts to do treatment plan over it, you can pat your back and you say that job well done. Because nobody has a clue that actually you have done something over there. Okay. Now, last case, with that we'll wind up.
So,
Yes.
how do you manage to get those white lines?
Yes, you can get those white lines by using colors. You have Shoku has white. You create grooves in the composite, apply this white stains over it, like here, and then finally cover them with enamel composites.
What was it of?
Did you see the canine? It had all fluorosilk parts over there.
So randomly.
Not random. You have to see where those white lines are there, and then you have to work towards the same white line. Now, since you asked that white line, this is pre-op. I'm telling you beforehand. So don't think it is post-op, and then don't waste time on thinking whether it is pre-op or post-op. This is post-op. Young lady, okay? Young is still 70 years, okay? Now, young lady, she wants her teeth to look nice. Will you prepare or will you not prepare? These are direct composites. That also I'm telling you. Let's not waste time on thinking whether direct or indirect. Question is, will you prepare or not? Label preparation. We are going to do veneers. Will you prep or not? No. Preparation, yes or no? Hmm? Okay, but then preparation is yes or no? Will you prep or will you not prep?
Not all of them.
Not?
All of them.
Okay, which one you want to prep?
In the central it is maybe.
Centrals, will you prep or not? Yes? See, this is very hypothetical what you say. Prep very conservatively means I don't know where you're going to prep, whether you're going to prep or you're assuming you're going to prep. Okay, why will it not want? Why? Wanting what? Indirect. No, I told you, don't think of indirect. I have cut off all that. This is pre-op, I told you, we are going direct composites. So forget indirect. Question is whether you will prep or not. No. It is already. No, that also I told you. This is pre-op. I am not confusing you now. See, can you understand why I am putting you through this? Is very simple decisions are the most difficult things in our life. Okay, if you ask, there's a war between Iran and Donald. If you ask, can it be stopped? Immediately you'll say yeah. We have no clue what's happening, but immediately you'll say yes. You have a tool, and call them 5 years, they will take a call because you actually don't. That's the problem. And then I told it's a lady, so you don't want to touch. The best thing is to tell her beautiful smile, tata bye peace of mind for everybody. But then how will we make money? Now, in this case, the problem is this one. This is the worst nightmare for any dentist. Why? Because when they smile, everyone in their family would have said, beautiful teeth you have. and now you do composite on top of this. If you can't recreate this, you are dead. Better to say bye. If not, then you have to pack your bag and go with her. If you're okay with that, then it is fine. Now, what I have done is, I've started composites. Are you able to see that? This is completely called a reverse layering technique. I'm just giving you a thought process that you can even do things like this. Okay, lots of nonsense we can do. This is one. So what I have done is, I have painted exactly where opalescence is. Okay, so I'm starting the reverse part of it. Then, close-up shot, what you're seeing blue is all I have painted it with are colors. So which means the first layer is colors form. Second, I have placed A to O. Okay. Then I have placed the shade of the composite covering the A to O. Then I have placed trans and finished it off. And all this, it's just 0.5 mm space. The same on the other side, build it up, layer, and finished. Now when you finish, this is not polished. This is just finished. And it is in a matte finish. But in a matte finish, if you can see those translucencies clearly, when you finish and polish, it will look so natural that none can figure out which is artificial, which is natural. Okay, so you can actually go to this level. So this is fully done composite restoration, but if you see, it is exactly looking like your natural teeth. There's a small mistake. Can you see an arrow over there? That's the bad thing of taking photographs and enlarging them to the maximum level. If the patient licks the teeth, no, that will go off. But then, that is not why you guys are here. You guys want to know where you can improve. So then, this is how you layer it, and now finish it off. This is not polished. Once this is polished, it will look as good as this one, and as confusing as. So when you do a work, no, none should know that it has been done. That's the bottom line. If somebody says good job, then it means you made a big mistake. So whenever you do the work, make sure the profile is too much out, then foot will get stuck between the tooth structure. So when you do a mock and then you realize that 1 mm it shoots out of the gingiva, you will prep it. Okay, that's the first indication. Second, if you can control that by adding it in very thin layers, you don't have to prep. Then, if you have any defects within the tooth, let it be karyogenic, let it be non-karyogenic, let it be developmental, then prep will be indicated. Otherwise, it is always no problem. And the last one is position of the teeth in comparison to the lip, in comparison to your alveolar bone, in comparison to the adjacent tooth structure. So this will all only will determine whether you're going to prep the tooth or not. Any other questions? Good then. We'll start with cases. More the cases, the more merrier it will be. Start taking up cases today. I think you can check whether the patients have come. And how many of you are going to practice? And PGs, forget, they don't have an option. You guys, how many of you are going to practice? And how many of you are going to do masters? In any field of your choice. Practice, masters. Which cons or ortho? Okay, fair enough. You guys, all endo. Okay, still we are still surviving. But another 10 years, endo will go on. I'm telling you now. Then don't join endo, and then she's like, what? She just woke up. What are you telling me? Endo will go off. Bye bye to endo. 5, 10 years, we will be only doing regeneration. So if you guys don't do regeneration, you will have no clue what to do after you finish it. And you will be sitting like this. Then going back and learning what to do with regeneration. So think twice before you think. Ortho will also go. The way the aligners are coming in, everybody is doing move. My patients are doing themselves. They call, they come home. It's one fellow came with an aligner. I said, I didn't do it. He said, you wouldn't do it. I did it myself. I said, what? I said, yeah. They said they can call. So one guy comes home, they scan, and then one dentist also goes. Sometimes I feel very sad, very, very sad. But then that's reality. So BDS goes along with one guy who knows to scan. God knows who is. We don't know. And then they scan, they send it. RNS come, they go home. The BDS fixes it, and then they deliver the RNS. I don't want to name the brand, but then it's so common. Whichever brand. So then they do it their own. So he comes, then he says, can you check? I said, this checking part only you are paying. Okay, so there's no checking happening here. You go back and check with the same dude who's done the work. But then, is it good, bad, ugly? We don't know. We really don't. If you ask the person, he says, I'm bringing the treatment to the doorsteps. But I believe we've not gone that down for us to go big in every door. That's my thought process. But then differs. So regeneration, PGs, magnification, and isolation. If you don't learn, 6 months stay back, please learn, and then come back. Without that, life is going to be tough. Undergraduates, if you want to start a practice, learn what they are learning in a course. I'm being very truthful, honest with you guys. Okay? Learn, but learn it proper so that you can start and do good, proper work. And when you join PG, make sure you join because you want to learn. Don't join because you want to have that MDS behind your name. But then that will fade off because sometimes, actually speaking, what you're going through is nothing. What we have gone through, and the teachers who tell us what they have gone through is actually close to nothing. Do you guys fail? Somebody's failed? Have you heard that anybody's failed in any subject? They failed? Undergraduation? How many? 100 are there, no? How many? 4, 5. That is 4%. Do you know how many used to fail when we studied? 50%. And PG, if before that, only one will pass. The other one has to fail when 2 seats are there. So which one will pass is at the mercy of the HOD. Now, PG, I don't think so anybody fails. That's the, I've never seen the past odd years, 15 odd years, I have never seen anyone fail in conservative dentistry. Anyone. Unimaginably bad students I've seen. Bad students meaning not a person, but they are forced to read conservative dentistry for XY reason because her father wanted to read. That one guy is so good on music, unimaginably good. Okay, he was forced to read. Forced means forced. He didn't have a choice. You know what he did? He did one thesis. Okay, he was supposed to find out bond strength of one particular product. And that product, I got it for him. And I know by heart that you can use it only for certain number of samples. After that, you can't use it because the product gets old. So I called a friend of mine is the HOD over there. So I called him. I said, "How's the study?" He said, "In unimaginable results." I said, "Unimaginable results. How many samples? We finished 120. Only 30 you can do." Okay, I said, "What?" He said, "Thank you so much for giving 2 more bottles." I said, "2 more bottles, sir?" I said, "Who gave you 2 more bottles?" He said, "You didn't give." I said, "No." But that fellow said he would give him. I said, "I didn't give." He said, "What the hell, man? This fellow, no, every day one heart attack he'll give me." He said, "Be online." Okay, I'm not there. Loudspeaker, okay? And then this fellow comes. So he asks him, "When did you get from Mohan, sir?" So see, I've got. He's telling me, he's showing me bottle full. When I listened to his loudspeaker, I told him, "I didn't send you. You tell me what you're doing." Then one silence was there. And he said, "Sir, I don't like what I'm doing. That we all know. We technically want you to pass and leave so that we'll be in peace of mind. So please tell us what you're doing." You know what that fellow did? Half he used. The rest is water, tap water. In a bonding agent. Can you believe? And then when it becomes half, then again he goes, fills, and he comes back. The I would say the most poor guy in this whole scenario was the HO. Because he didn't know what to do with him. You can't scold because he's very clear. He's clear that if you fail me, I will be like this. So you know what we did? The entire college made sure that I passed. Right from first year to final year, all stuffs. Everybody. So they said, "See, this is a good boy. Extremely good boy." And you know now what he is doing? He has his own music band. That fellow is enjoying life. So he said, "So this is what I create." He never calls him dentist. He never calls him doctor. So sometimes you should really go towards what your heart says. This is not for PTs. Okay, you have decided what to do with your life. I am telling the ones who are sitting in front of you. So you should actually go. And I'm standing here because of the same reason. I love what I'm doing. For me, this is sheer love. So I make mistakes, I learn, then I teach. So if you have that guts to make a mistake, learn out of it, and then come successful. Not minding on whether you're going to pass or whether you're going to fail. If that you can do to a subject, no, then you will master it like anything. If you keep passing as a criteria for you to learn, then you will not learn. So when I joined PG, I was very clear. It's okay, even 6 months. I'm okay with it. 3 years we have struggled. Another 6 months work. Big deal. But then unfortunately you pass. You like it or not. So that is how PG works. And if you have that mind, it's easier even for the staffs. Because we will push, we will actually push you to your limit. And and there will be one limit where you will break. But then you will still be pushed. There will be no consideration. When you cross that, right, after that, it's easy. But then this is exactly what PG tests you morally. Theoretically, you're all fine. But that moral strength, no, that is where some lose, some win. So PG is like that. Imagine only for conservative dentistry, it is like this. Prosto, I have no. Any prosto dentist here? No, good. I can't imagine. When I joined PG, I thought of it, and for a second I thought, no way. With teeth itself, I can't imagine. Imagine one mouth without any teeth. What will you do? You have to imagine that plane, this plane. Conservatives. So that's how I chose. So you guys think properly what you want to do with your life. And then you decide. If you feel dentistry is not my cup of tea, let go. Start something which you really, and then success comes only in that. Because you are ready to lose. When you are ready to lose, no, then it is sure win. If you want only to win, you can't take up the loss. I was very clear to fail. I was so sure to fail. I even told my guy, I'm coming after 6 months. I'm okay with this. Just ask me to go. But then, these 3 years, they keep a track record. Do you have books for yourself where you write something for post PG? Daily book? No, that diary you will write nonsense of yourself. Do you have a book where you go, there's a submission date, you will sign, and then if you don't, you yourself will write that I have not submitted my work. Any book is there? We had a book there. Okay, good, no staff is there. That's okay. You will not do. So we had a book. So that book is given on day 1. And my boss was very clear. I am the boss, I am always right. Is it clear? He said yes. Repeat, the boss is always right. So that book, day 1, day 2, day 3, day 4, like the 365 days will be there. Every 15 days we will have an exam. And if we fail, we go like, I have failed this exam. Sign. Why? Because on a later date, it can be used against you. Because you are signing, you are writing. So in that I am okay to fail for 6 months. And I signed. Because certain things I felt I had no clue about it. And when I passed, I thought I had every clue about it. 2 months down the lane, I understood I didn't study PG itself. I did only root canals. And I had no clue even about the clamps. Leave alone root canal. When somebody asks about certain clamps, I had no clue. Ring clamps, no clue. Ringless clamps, absolutely no. Theory I tried. Where will you place the clamp? No. When will you choose this clamp? What is an anchorage clamp? No idea. Worst was composite. I thought I was master in composites when I finished my post-graduation. You come out, then you know that you only know A2. And you believe A2 will work with everything in life. And then when you have A1, B1, you don't know what to do with A1, you don't know what to do with B1. And then when somebody comes and talks, they'll show pre-op, they'll show post-op. What happens inside that? Nobody explains. And you don't know whether this is right or this is wrong because already you are passed, your patient is sitting there. I can't make mistakes over there when I'm a consultant already. Once, twice, any hospital will agree to the mistake what you do. Third time, they will quietly push you and ask somebody else to come in. So, all this is a good exposure for you guys. So that you will learn out of the mistakes what I do, so that you will not make the same mistake. You make new mistakes so that you will learn from them. Done? Okay. Patients are okay, very important. We need to eat. Please go for breakfast.